Hi, welcome to New Age. Thanks for visiting our website. Gynecomastia surgery is a procedure that's also known as a male breast reduction. There's two goals of this surgery. So the first goal is to make it look like someone does not have gynecomastia, and that's defined as the abnormal presence of female breast tissue in the chest of a man. The second goal is to make it look like someone never had surgery. So what we want is that for my patients, they can take their shirt off and you don't see a bunch of scars. The scars are hidden. So there's different types of gynecomastia and there's different ways to treat it. Most often, we will put a hidden incision when we do this operation at the bottom of the areola. So that'd be from the 3 o'clock to the 9 o'clock position. And then we lift up the areola, and that gives us access to any glandular tissue or breast tissue within the chest in this area. Now, there's different types of gynecomastia. There's a glandular form, there's also a fatty form, and then there's a mixture. If someone has a type of gynecomastia that is purely made of fat, this is something where sometimes I don't need to make that incision. Sometimes I can just make a small incision underneath here in the side of the chest, and I can use liposuction. And so liposuction is a treatment where we make a small, like 5mm incision, and we use an instrument called a cannula, which is like a big long rod with some holes in the end hooked up to a vacuum, and we just suck out fat. The problem is liposuction will not remove glandular tissue. And so a lot of the times I will start with doing liposuction and then see that there's a bit of glandular tissue afterwards, and we do have to commit to making that incision. We never skimp on the result. Here, I would never try to just do everything with liposuction and leave a bit of gland behind, because if you were to ever do that, patients would know, and they will be coming back and telling you that they want it removed. So the whole point of the operation is to give someone as flat of a chest contour as we possibly can. The surgery is often done under a general anesthetic. It usually takes me around an hour and a half. There are some select cases where I can do it under local anesthetic, but most people need to be put to sleep for this. When patients wake up, there's bandages on their chest, and there's also a compression vest. The bandages come off at a week, and the compression vest stays on for about 4 weeks. The recovery process is, most people would need about a week off of work, but you would need about 4 weeks off before things like going to the gym, that kind of thing, just because we want to avoid any chance of a complication. If you're interested in learning more about this procedure or booking a consultation, you can scroll down to the bottom of the page and put in a request for a consultation.